Sister Ferenchak, Mr. Marles, and Mr. Shamberg. Thank you for being here today. And Sister, I have to tell you, I don't know whether it was divine intervention, but I think you and I were thinking along the same lines going into this hearing today, because last Thursday I read the Department of Health memo that they posted to their message board for all administrators, stating that if the nursing home and long-term care administrators were not reporting that data to the department, or reporting inaccurate information to the department, that they could face a daily fine of $300 or even up to 30 days in prison. And I think this is what the letter looked like, and I was very, very concerned because I understand that these are really extenuating circumstances and very challenging and difficult times, and potentially losing an administrator because of an inaccuracy in what you've posted could put a facility into a tailspin. And I didn't really understand or know all the intricacies and details of the reporting requirements that your facilities now must follow. And you provided an excellent overview on how your reporting process works, who you have to report to, and how many reports you're required to file. And I honestly could not keep up as I wrote all those details, because I really didn't know until your explanation and your testimony here today. I guess my question that I'm left with is, what kind of assistance are you being provided to, and guidance to fill out these copious numbers of reports that you have to make? I know that in previous testimony before this committee, the Secretary Levine proffered that ECRI was there to assist facilities. What kind of assistance are you getting, guidance, resources, to provide this data? And I think data collection is very, very important. We need to make data-driven decisions here in the General Assembly, as well as at the Department of Health and the Department of Human Services. So, Sister, I don't know if you have some thoughts. I'm sure that both Mr. Shamberg and Mr. Marles may have some thoughts as well. Thank you.
I would just say thank you for your question. Initially, there was a lot of confusion about the reporting, needless to say, because of the number of items that were requested. We did not really receive any instruction on the Knowledge Center Corvina as to some of the specificity in some of the questions, but we, I think, have worked through it here, at least to be consistent in what we're reporting. I know that the survey to the Department of Health, Survey 123, there was a lot of concerns about that, because there was an initial survey that had to be submitted, and then that was completed, and then it was unclear from the Department of Health that there was a second phase to that, that you had to enter into a second phase. Many facilities were reporting on the first phase and not the second phase, and it was only by instructions that were given over the internet from the site to how to access that and report that. The CDC guidance came from the National Health Safety Network, and that again had to be set up, and the access to it was only through the directives that were given. Those are the only accesses that we had, and the only instructions that we had in setting these up and reporting them.
And Senator, I hope it's okay if I jump in. I'd just like to add a few things. Keep in mind, with our membership, which touches every corner of Pennsylvania, we have nursing homes reporting to up to 5 different databases on a daily or weekly basis. And some of that reporting goes to the state, some of it goes to the county, and as the sister said, one data set does go to the federal CDC. But here's the challenge. With each of those databases, definitions are different. Some reports ask you to count daily, others are cumulative, and most, as the sister pointed out, ask the exact same information. And I really would like to address that memo, because I think it's very important for this committee to hear. And I think I can speak for every administrator and frontline staffer and every person who has had to spend hours reporting that data, in some cases before 8 a.m., when I say how insulting it was to see that memo released on Thursday evening. Here at PHCA, we followed up with the department and we asked for a list of which facilities still needed to report. We wanted to help. It's been 6 days and we've yet to receive a response from the department on that. The nursing home administrators that I've spoken with in our membership have told us that they heard nothing from the Department of Health up to that point in terms of failure to report, in terms of unintentional misreporting, or even acknowledgement that the daily reports had been received in the first place. And that goes back to my point about collaboration. Rather than work together with the providers on the front lines, our healthcare workers are being threatened with prison time. And one administrator told me that this latest order made it very clear to her that the long-term care industry here in Pennsylvania is viewed as the enemy, not the COVID-19 virus. And that's too bad.
And that's concerning because, Mr. Shamberg, I think we all have to work together to protect the lives of our most vulnerable citizens. And I would ask that your organization please provide this committee with a list of all of those data reporting requirements, who they go to, and what you need to report so that we can begin to advocate for a more responsible, useful, efficient reporting of data, streamline it, because it is important that we make data-driven decisions with regard to care for our seniors.
Senator, if I may, one additional comment. I agree with everything that's been said so far, and I want to take a moment to just take exception with one comment that the secretary made in her testimony, where she alleged that every error in the data was because nursing homes reported bad data. I can tell you without exception that there were multiple instances of nursing facilities repeatedly reporting and re-reporting correct data that was then incorrectly listed on the website. Attempts were made in many cases to report it, sometimes by both the facility and the association. We've had multiple members of our staff trying to serve as a conduit between the two to make sure that things are accurate. And the vast majority of the cases that we've seen have not been misreported by the nursing facilities. There has been a data issue on the back end with DOH or some system that they're using, but I just want to make sure that we're very clear. The issue here has not been nursing facilities not doing what they're asked to do. The vast majority of them have done it and done it very, very well.
And I would say to you as well, Mr. Marles, any of that information that you could provide to this committee to assist us in our efforts to streamline and make this process more efficient would be very much appreciated.